Here's my presentation on disproportionality and CEIS. Okay, so what is disproportionality? Disproportionality is overrepresentation of minority students identified with a learning disability or other type of disability under IDEA. When a minority group's numbers in special education are statistically higher than they should be, they are considered disproportionate. The criteria is that a disproportionality review is administered to LEAs as a way to review policies, procedures, and practices that may lead to disproportionality. The focus areas under this review are school-wide approaches and pre-referral interventions, child find, evaluation and reevaluation, eligibility determination, and discipline. Within those areas, if noncompliance is noted, it must be corrected no later than 1 year from the notification. For the noncompliance areas, schools will follow a corrective action plan. The procedures must be developed within 30 to 60 days of notification to attempt to improve in the noncompliance areas. The national and Georgia statistics of disproportionality. Nationally, Black students are suspended 5 times or higher than their enrollment in population. In Georgia, 37% of students in Georgia schools were Black, but they comprised of 67% of suspensions and 64% of expulsions, showing their overrepresentation. In the last 5 years, 80% of the overrepresentation determinations of Black students with disabilities was those with an intellectual disability. 37% of white students with overrepresentation determinations had a speech-language determination. A speech-language impairment. From the school years 2002 to 2003 to the school years 2007, out-of-school suspensions have decreased by 3% for white students and have increased by 8% for Black students and 14% for Latino students. For those same years, expulsions have decreased by 2% for white students and increased by 33% for Black students and 6% for Latino students. What is CEIS? CEIS stands for Coordinating Early Intervening Services. It is assistance given to students who haven't been identified as needing special education, but need additional supports to succeed in the general education environment. It also addresses inequitable practices for children with disabilities by race and ethnicity. The criteria for CEIS is that 15% of IDEA Part B funds must be reserved to provide CEIS for at-risk students. Local policies and procedures must be reviewed and revised as needed. They must then be publicly reported. An LEA must implement and monitor the CEIS plan and input children into the Georgia Department of Education portal. The Georgia Department of Education must monitor the expenditure of CEIS funds and also must monitor students for an additional 2 years after identification. Who can receive these services? Children who are not currently receiving special education services and related services under IDEA may be able to qualify. Students who may need additional support academically or behaviorally may also qualify. Students who were eligible in the past for special education services but are no longer eligible can also qualify. The plan for CEIS starts with the district. The district will conduct a comprehensive data analysis. The stakeholder team will then clearly articulate a summary of specific trends in the data. The data analysis will point to specific schools and groups of students within the schools. The first step for the schools is to describe the intervention and how the services will support the identified needs of the group of students. The intervention must be systematically implemented, target instruction based on student needs, be connected to a specific goal, have defined step-by-step directions, include staff training if needed, and include ongoing data and progress monitoring. Second, the school must describe the targeted audience and how the intervention meets their diverse needs. You may then describe the entrance and exit tool and criteria used to identify the students. The last step is to describe the ongoing progress monitoring procedures and describe the plan to monitor and assess fidelity of implementation. CEIS funds can be spent on interventions, progress monitoring, after-school programs, travel, electronic devices, instructional materials, and on personnel such as substitutes and paraprofessionals. The relationship for students with disabilities is that there is a significant disproportionality for discipline if students with disabilities are receiving OSS for more than 10 days, and if there are racial or ethnic differences in students with disabilities receiving OSS for more than 10 days. Typically with behavioral data, students with disabilities are overrepresented for receiving discipline than other students within the school. The impact on graduation rates is that for students who are suspended or expelled, they are more likely to drop out of school than those who are not. If there are effective interventions and effective implementations, there will be positive outcomes, hopefully leading to an increase in graduation rates. This is where it becomes very important for schools to pay attention to their disproportionality and to follow their improvement plans. For those students that are being overrepresented, they most likely will have a lower graduation rate. But if schools are trying to improve their overrepresentation, they should see that graduation rate start to rise. Reasons to address are that when students are expelled or suspended, they are losing instructional time in the classroom. Students who are being expelled or suspended are most likely do not want to be at school, meaning that this is a reward for them. Some students may view suspension or expulsion as they are not worth the teacher's time. Some implications for leaders are that it is the role of the leaders to help the school create a welcoming, caring school environment. There should be a school-wide discipline program. They should help create improvement plans to decrease disproportionality, and they should help with monitoring data to ensure that programs and interventions are effective.